Hello Ginny, thanks very much for agreeing to take part in this series of videos. We're trying to put together some videos that will give therapists working with children with cerebral palsy a bit more information about certain aspects of their management, and you've done a recent in-depth study into positioning children and the use of sleep systems and how families found that. And I'd just like to ask you to explain a little bit more what you found for therapists to sort of understand the complexities of it all, really. Can you just first of all explain why you chose nighttime positioning as something to look at in depth?
Certainly. Certainly the studies that have been done so far have not identified nighttime positioning separately as being beneficial or not beneficial. There have been studies, particularly by Terry Pountney, looking at 24-hour postural management and the benefits of that, but we don't know which part of that is the most important. But a group of experts recommend that children with moderate or severe bilateral cerebral palsy should have nighttime positioning from very, very early. So really from as soon as they're identified as having motor skill problems.
Right.
And that's fine, and therapists have been prescribing sleep systems for a number of years, and the research is not keeping up with that. So we still don't have strong evidence that it's beneficial, but we think it is. But what we don't know is what that experience of using a sleep system is like from the child's point of view and the family.
Right.
And we know, I'm sure all therapists will have families who have taken up the offer of a sleep system but then abandoned it, and other families who they couldn't persuade to take up the offer of a sleep system. So I wanted to know more about what factors come into play there. So in fact what I did was to interview children from 3 upwards with little or no with language, verbal communication skills or without.
Right.
So with a speech therapist we use the talking mat to enable children to give their views. And I interviewed parents and I interviewed their therapist as to why they chose that child and that sleep system, what their clinical reasoning was.
Right, interesting. And how did you identify those children in particular? How did they?
I asked local therapists to opt into the study and to ask parents of children who were at the point of being supplied with a sleep system.
Right.
So they were children on local therapist caseloads who were about to be prescribed a sleep system, and the therapists opted them into the study. Well, the therapists opted in and the parents agreed.
And what were the surprises for you in that study that you did?
The big surprise, I think, was, along with the reading that I did, was the incidence of sleep difficulties in that group of children and families. And it was something that I hadn't considered enough as a therapist prescribing a sleep system. But certainly a high percentage of children with moderate or severe cerebral palsy are likely to have difficulties with sleep. And the pilot study I did, just a practice interview with a parent of a child who'd been offered a sleep system, just threw up so many problems really for families, and the tale that she told was quite heartbreaking in terms of the lack of support and the lack of understanding that professionals had around her case. And this was a child who had a lot of complex medical problems, who had never learnt to go to sleep on her own, and who shared a bed with her mother, or demanded that her mother shared her bed to go to sleep. She'd never learnt to sleep on her own and had been given a sleep system to try and help her sleep, but without the therapist hadn't, as most of us probably didn't or don't, conducted a really in-depth sleep history. So really finding out what all those factors contributing to a child not going to sleep are. Because unless a child can go to sleep, they're not going to be able to use a sleep system.
No. Right.
And I think that's something that I hadn't considered well enough before.
And so are there tools that you can use now in terms of getting that sleep history? Would you say there's certain key things that we should look at?
Yes, absolutely. And the questionnaire that I used in my research study, which is very recently on the market and has been researched, is the Chaley Sleep Questionnaire,
Right.
and devised by Jessica Underhill and Yasmin Khan at Chaley Heritage. And it's a very thorough, well-worked questionnaire which asks all the questions that you need to know about what a child,
families do.
what families do, so what the bedtime routine is, but also questions about the child's medical status.
Right.
And then it flags up key items, which if the answer is that the child does have these things or does do this, flags it up as a red flag that you should then discuss with child's paediatrician. And I would recommend that therapists use that sleep questionnaire. It's a risk assessment as much as anything else.
Yes.
It gives you a good sleep history, so it
Yes.
can answer lots of questions,
Mhm.
but it's also a risk assessment, because these are delicate children, fragile children sometimes, and we need to make sure that we're not making things worse for them by putting them into a sleep system. And it will reassure us most of the time that actually
We've covered everything.
We've covered everything, yes.
Okay. What were your key findings in the research that you've just completed?
Well, the sleep difficulties was certainly one, and the fact that there's very little as yet in most parts of the country in terms of sleep services and counselling for families, practical help to enable families to get their child to sleep better.
Right.
There are some services, and certainly the government is requesting that there are sleep services, because it's mentioned in the National Service Framework for Children that many children don't sleep well and that families don't get help that they need. So families should pester their paediatrician for a referral to someone locally that will help. Another finding, which again I wasn't sensitised enough to, I think, is pain. And I came across 2 3-year-olds in my study who reported to me, using the talking mat, that they had pain, and that it was pain that woke them up at night.
Right.
And I was surprised. Neither child had, one child had the beginnings of some muscle contractures, the other child didn't. They were not children that I would have expected to be in pain. I think probably as therapists we might expect adolescents or young adults, because they do tell us, and we know by that time often there has been surgical intervention and physical changes. But as young as 3, I was really quite surprised, and I think therapists must be aware that children as young as 3 might be in pain, and they need to make sure that they've got tools available to find out if that child is in pain. The paediatric pain profile is a good tool for use by parents. It's an observational tool, so parents can observe, and school carers, school staff can also complete it. But also children who don't have verbal communication might very well be able to tell you using the talking mat. I needed a competent speech therapist to ask those questions, because it's quite difficult unless you're trained to ask questions clearly enough.
Yes.
I used too many words and too many concepts, and then speech therapist did it. She kept it very simple. And the children were able to tell us, yes, not only that they did have pain, but where the pain was. And both children corroborated that when I interviewed them again 6 months later. They told me the same story. So I think that was reliable.
Okay. So, in terms of your message to therapists, how do you think we might improve the situation to enable children to benefit from better positioning at night?
Well, I think they need to they need to make sure that they understand what the sleep difficulty issues are. They need to know if the child is in pain, and they need to listen to children and give the children the opportunity to have a voice and to have a say in what happens to them, because they need to be empowered to be able to make decisions when they're older. And certainly professionals in adult services will often say that children enter adult services unable to make decisions about their future care, and we need to be empowering children to do that from an early age, I think. We also need to be competent as therapists, that we have the knowledge and the experience to be able to make the right decisions and the right clinical prescriptions for children. And that means having seen enough children. Certainly, I think a therapist who works part-time and may only have one or two complex children on their caseload, we shouldn't expect that those therapists are competent to provide a postural management program and understand and be up to date with all the current equipment.
They need support as well.
They need support from a specialist, yes. And I think that we should evidence that we are competent.
Yes.
We would if we were respiratory physiotherapists.
Yes.
And I think we should, as postural management therapists, we should be able to evidence that we're competent, and we should have the support of a specialist.
Right.
And then I think as we are thinking through which child and which sleep system, it would be helpful to use the ICF model, looking not only at the function and the impairments, but we should be looking at the personal factors, because not all children will be able to adapt to sleeping in the sleep system, and I think that needs to be considered. A lot of children will, but a few just may find change too difficult. And we have to consider their health needs. Not all children will be appropriate to be positioned in a sleep system. Most will, but we need to know those that aren't. Yes. And in terms of parents, I think we can think in terms of personal factors around the children, personal factors around the parents and the therapists. Yes. And I think thinking about parents, not all parents are going to be prepared to persevere with getting a child to sleep in a sleep system. Some children will sleep better and wonderfully well the first night, but many won't, and they need to get used to it, and it needs to be persevered with, and the parents need to be very clear with their children why they're asking them to sleep differently, and then to stick to their guns and stick with it.
So there's a lot of information they need before they decide to undertake this.
Absolutely. Parents need to understand why their therapists are asking them to put their child in a sleep system. It's not a normal thing, it's not a natural thing really. And I've heard parents say that grandparents find it very difficult to accept that their grandchildren are being asked to sleep in a piece of equipment. So parents need the information, and grandparents perhaps need that information. All carers ideally would be trained in postural management, and there's some very good practice around of training all the carers around a particular child. The parents, the grandparents, the siblings maybe, and the carers in school and respite care, everybody, so that it's a joint effort.
Known about.
Absolutely, and the parents aren't left to tell their parents, their grandparents, the whole thing. Right. And then just to finish with, I think therapists do need to be competent, and they do need to be supported by someone with the specialism. And if all those factors aren't ideal and optimal, so if the child isn't likely to be able to be persuaded to sleep in a sleep system, or the parents aren't ready to persevere, or the therapist isn't competent, or any of those, then I think other methods have to be thought about.
Yes.
And don't push ahead
With
down a
piece of
road
equipment.
where you're not likely to succeed, because that's not good for anybody, child, parents or therapist.
Thank you very much, Ginny. That's really useful. I hope people find it interesting and useful to their practice.
Thank you.